We're speaking with Dr. Felix Frueh, President, Medco Research Institute. And Dr. Frueh, what is Medco doing to advance the field of personalized medicine?
Well, thank you for the opportunity to give our perspective here. We're working in personalized medicine really on two ends. We're working on it on research side, and we're working on it on the providing access to patients commercial side of personalized medicine. We do research because we want to identify what the opportunities are. We have a multitude of different drugs out there for which we already know very well that using a simple genetic test for this enzyme, the other enzyme, could really help target patients much better, identify patients that may get that are exposed to an adverse event, patients that may need a higher or a lower dose for a particular drug. And once we've done that research, we don't want to stop there because, as you probably know, Medco serves about 65 million patients. So we want to take that next step and translate these findings into clinical practice. So we want to provide access to these tests, to that information, to our patients. And that's where the commercial clinical programs come into play.
What are some of the techniques or processes to evaluate this vast amount of clinical data?
So we're using predominantly what we call quasi-experimental trials if we go out and do something prospectively. So if we have an idea that, for example, a particular genetic test could change patient outcomes in the way that we're expecting it to be, meaning for the better, we want to go out and actually perform that genetic test and then follow patient over time and monitor their outcomes, so doing a prospective study. On the other hand, we have access to a lot of retrospective just data, so we can do a lot of in silico analytics, database searches, where we look for correlations between pharmacy use and outcomes as well. So we have, on one hand, an approach where we can use the information that we already have to do data mining to look for various different associations. And at the same time, we can use our patient population to do these critical forward-looking studies where we really don't know what the outcome is. We have an idea, but we want to prove it. So that's the way that we position ourselves with the logistics, with the operations, with the access to patients that we have, and to do that research.